Hey there, my name is Tanner Risco. I'm a third-year medical student at Kansas City University in Joplin, Missouri, and in this presentation I'll be discussing the fundamentals of ultrasound and how to perform a fast scan. Now before we get started, I wanted to discuss a few brief words on point-of-care ultrasound and why it's become so popular in almost every field of medicine. Importantly, ultrasound can be performed at your patient's bedside in order to aid you in your clinical decision-making process. Ultrasound can be diagnostic, procedural, or therapeutic in its use. There's no ionizing radiation involved. It's non-invasive, relatively accessible, portable, and efficient with your time. You can use it for immediate feedback on procedures you wish to perform through ultrasound guidance. It's easy to use with a little bit of training and practice. It's inexpensive and becoming more affordable every day. And importantly, in trauma situations, you can perform serial assessments on patients you wish to follow throughout their clinical course in order to provide the best care possible. Now, when you're preparing to perform an ultrasound exam, there's a couple things that come to mind in order to obtain a good scan. Naturally, you want to know the anatomy of the region you're assessing, additionally dimming the lights in order to see the monitor better, making sure your ultrasound has power, and also ensuring adequate patient positioning become important. Ultrasound machines have presets on them in order to provide you with the optimal setting for the average patient undergoing the exam. However, natural variations in body habitus merit optimization of that image using the depth and gain features in order to obtain the best view. Ultimately, the use of ultrasound becomes relatively operator dependent. However, the adequate visualization of important anatomic structures and spaces come with practice. The orientation of the probe can either be in a transverse or longitudinal plane. In a transverse plane, for example, if you look at the bottom left side of the screen and imagine the yellow line to be skin and the red to be the aorta, in a transverse view, you can see a cross-section of the aorta, and in a longitudinal view, you can see along the aorta. There are various movements of a probe that you can use, including sliding, rotating, tilting, and rocking, and many more. There's an orientation marker on one side of the head of the probe. That correlates to what you see on the screen. Flipping the probe in space will change the orientation on the screen. Various movements of the probe include sliding, where you move along the skin without changing angles, rocking, where you tilt along the axis of the indicator, fanning, where you tilt the probe perpendicular to the axis of the indicator, and then rotating, where you rotate the probe along the axis of the cord that it's attached to. Frequency is measured in hertz, or number of cycles per second. This becomes important when you're selecting a probe for use. A lower frequency probe emits a longer wavelength and is therefore able to dive deeper into structures, but does not provide the best resolution. A higher frequency probe provides a shorter wavelength and is therefore able to provide better resolution, but does not dive as deep into tissues. An ultrasound works by producing a beam, and every time that echo is reflected back, a crystal deforms and vibrates, which generates another impulse and is then processed onto an image on your monitor. This becomes important because the propagation speed of is different in different tissues. Echogenicity is defined as the ability of a structure to reflect sound waves or echoes. As you can see on the upper right side of the screen, solid, liquid, tissue, or bone all have different echogenicities. A hyperechoic region is brighter echoes than the surrounding structure. Isoechoic is equal in echoes to the surrounding structures. Hypoechoic is darker than the surrounding structures, and then anechoic is completely black. FastScan stands for Focused Assessment with Sonography in Trauma. Its purpose is to provide a rapid screening test for trauma patients. It has a limited sensitivity and cannot completely rule out intra-abdominal injury. However, you can use a FastScan in order to detect free intraperitoneal fluid, pericardial fluid, pleural fluid, hemothorax, or pneumothorax. Additionally, it's important to consider patients that may not be stable enough to be transported for a CT or additional imaging. The FastScan consists of 4 views: the right flank, the left flank, the suprapubic region, and the subxiphoid region. On the screen are 4 views demonstrating the FastScan with normal anatomy or a negative FastScan. On the upper left side, you can see a right flank view or a hepatorenal view demonstrating an important anatomical space known as Morrison's pouch. This becomes important to look for fluid collections or separation between the liver and the kidney. The left flank, or perisplenic view, the pelvic view, where you can visualize the bladder on the top part of that screen, and then the pericardial view, where you can visualize the chambers of the heart and the pericardium. Here is a right flank or hepatorenal view. This slide demonstrates the appropriate placement of the ultrasound on the right flank, and then also an ultrasound demonstrating normal anatomy of the kidney and liver on the right flank. Note the hyperechoic region in between the liver and kidney, being the fascia between. This is a potential space known as Morrison's pouch where fluid can collect in the settings of trauma. It would appear as a hypoechoic region in between the liver and kidney. Here is the left flank, or perisplenic view, with the slide demonstrating appropriate ultrasound placement near the posterior mid-axillary line, and the spleen and kidney in view. Here is a pelvic or suprapubic view with the appropriate placement of the ultrasound probe demonstrated as pointing towards the urinary bladder. This is a normal scan, but you would inspect for free fluid outside of the bladder in the setting of trauma. And here is the pericardial view in the subxiphoid region, demonstrating appropriate placement of the ultrasound probe, the heart chambers, and the pericardium. Hopefully you know how to perform a fast scan now, because a 27-year-old male unrestrained intoxicated driver just presented to your emergency department after a motor vehicle accident. He complains of diffuse abdominal pain, and you decide to perform an ultrasound fast scan at the bedside. As you perform the fast scan on this patient, you notice free fluid in Morrison's pouch on the right upper quadrant in between the liver and the kidney. Because of your training and practice in ultrasound, you're better able to quickly obtain images like this, interpret them, and ultimately improve your patient care. I would like to say thank you for your time and learning a little bit more about ultrasound with me today. I hope that it's prompted you to look more into this topic and hopefully get some hands-on experience sometime soon. I would like to say thank you to the KCU Joplin Clinical Education Department. And then also, if you're more interested in this topic, there are two great textbooks called The Pocket Guide to Point of Care Ultrasound and Critical Care Ultrasound that can help you further in this endeavor. Thank you and have a great day.